Hey everybody, welcome back to my channel. Today we're going to talk about Takayasu arteritis. Takayasu arteritis. So, what is Takayasu arteritis, right? You can already see that it's arteritis, so you can already make out from the name that it's a type of vasculitis, right? Now, let's first talk about the epidemiology of this disease. So it's going to be seen in, let me enlarge this. It's going to be seen in young Asian women. So I have taken the liberty of putting out the pictures of some young Asian celebrities that I like a lot. One is Medve Ramakrishnan, the other one is Lana Condor, and the other one is Ali Wong. She is okay. One more thing that I want to make clear is that it happens in women that are 40 or less than 40 years of age, and you can remember it by Ali Wong is now 40, so like you want to think Ali Wong or younger. Okay. So what does it present with, right? So with Takayasu, you're going to see all of these features. So first of all, let's talk about what part of uh, the body it affects. So when you think about Takayasu arteritis, you want to be thinking first of all arch of aorta, right? Arch of aorta, and like the aorta itself, aorta, and the proximal branches. Proximal branches. Okay, branches. One, two, three. Okay, so proximal branches, you know them. You know the brachiocephalic. You know um the subclavian and the uh, internal carotid. So all of the proximal branches of the aorta are the ones that are going to be affected in um, Takayasu arteritis. Now, let's move on. You want to look at this picture because I know that giant cell arteritis and Takayasu can be pretty confusing for most people, right? So you wanna look at this diagram. I actually cannot remember at this point where I took it from, but this shows you that giant cell arteritis mostly affects the head. Like they'll complain of um, let me change the color. They're going to complain of the temples hurting, and they're going to have jaw claudication and stuff like that. It's mostly going to be restricted to the head and the face. But Takayasu can present with upper limb symptoms. Give me a sec. Takayasu can present with upper limb symptoms, and when we talk about aorta and all of its proximal branches and some of its distal branches, sometimes the distal branches can also get affected. So you want to be thinking of a very wide range of symptoms. We're going to get to that under clinical features and complications, right? So let's get back to that. So, like I said, they can have claudication. They can have, it's also called pulseless disease because when you take someone that's suffering from Takayasu and if you palpate their pulses, you're not going to feel the radial pulse as robustly as you would in a patient without the pathology. And there can be blood pressure discrepancies because there's no guarantee that the whole arch of aorta is going to be affected. Maybe it's just one part of the aorta that gets affected, and that might cause the patient to have only right arm symptoms and the left arm is normal or something like that. So there can be discrepancies, and the important thing to think about is that it's going to have constitutional symptoms like all other vasculitides, right? They can have weight loss, they can have arthralgias, myalgias. So think about it. If a patient with who's Asian and less than 40 years old comes in with constitutional symptoms, you do want to think about Takayasu. Okay. Now, like I said before, there can be complications because, like I said, it has a wide range, right? So we could be thinking about, neurological, right? They can have stroke, they can have aneurysms, they can have transient ischemic attack, and all of these things. And then because the arch of aorta and the very proximal part of aorta can be affected, they can have aortic valve regurgitation. One more thing you do want to think about is that some of them can actually present with angina, right? Because you already know that the coronaries are actually branches of the aorta itself, so they can have angina and they can present with renal artery stenosis. So this is a pretty wide range of presentation, and you always wanna think about it in a young Asian woman. Now, obviously the first impulse of any physician would be to order some blood work. So whenever you it- take blood work, you're not going to see anything very specific. It's just going to be like a rise in inflammatory markers like ESR and CRP, right? But then you wanna go ahead and if you go ahead and image them, for instance, you sorry about that. If you take a chest x-ray, for instance, you're going to see mediastinal widening. Let me change the color. You're going to see mediastinal widening because the arch of aorta can very well be affected, so there's going to be aortic dilation. And obviously this is again confirmed when you do see sorry MR or CT angiogram, right? Shh. MR or CT angiogram. What you're going to see on MR and CT angiogram is that the local changes when it comes to Takayasu is going to be granulomatous inflammation of the eight arterial media. So there's going to be thickening of the wall and narrowing of the lumen, and that can be seen on the angiogram. And you can see that the aorta has become pretty wonky over here, right? You can see that it's just not that smooth structure of the aorta that you'd be expecting to see. It's all big and small and everything in between, right? So that's another thing that you want to look out for. So how do you manage this? That's pretty straightforward. Anybody, especially on the boards, if they ask you how do you manage Takayasu arteritis, it's going to be steroids. When it comes to practice essentials, I'm really not sure what are the advances when it comes to managing Takayasu arteritis, but I can for sure make another video on, like, just management of all the types of vasculitides, right? But for now, for board purposes, I think remembering that it's managed with steroids is sufficient. All right, so that's Takayasu. I know I got a little confused at first with the because it has a pretty wide range of presentation. So it might be a hard diagnosis to pin down. So you want to think about all the possibilities. I hope that this was helpful. And until next time,